Good day, students. I shall be continuing with my series on chips and game for rats. And game means gross and microscopy explained. This particular chart appears extremely simple, but then it might be difficult for us to describe it vividly. Let us see how best we can do it. Fine. This can be a specimen for us, a mounted specimen. Of course, this has been taken from Wikipedia, thanks to them. I am finding a resected specimen of the uterus with cervix. This elongation is the cervix, and what is seen in this picture is the external surface. It is not just round, it is bossellated, it is bulging. And always we will have to see a cut surface. When I go to a cut surface over here, I'm finding some large tumor, which is displacing the uterine cavity. Normally, this uterine cavity is something like a triangle, but here it is compressed and pushed to one side. And incidentally, I'm able to see a solid pinkish white tumor which has got a whorled appearance. And this is the normal myometrium that I'm seeing. And this is the cut surface of the cervix. It has got an Aborthian cyst. This picture is again from Wikipedia, a classical picture which I would like you people to appreciate and describe. So this is again a specimen of the uterus. This is the fundus over here, and I'm finding a large lesion that is bulging into the uterine cavity. Yellowish white or pinkish white, you can call it. Not much areas of necrosis. And it is bulging into the uterine cavity. The uterine wall in turn is becoming slightly thinned out here, whereas it is normal in this region. This will be a classical picture that I would like you people to describe well. So it is a specimen of the uterus. I'm able to see the V shape or the pear shaped uterus. And these are the couple of fallopian tubes and the ovaries. This is the cervix over here and the vaginal canal. These dark blue structures are the tumors we are talking about, namely the leiomyomata. Look at the locations. This is the mucosa. Immediately beneath the mucosa, it is located. So it is called a submucosal fibroid or leiomyoma. This is the outer layer or the serosa, and beneath that I am able to see. So it is called a subserosa. It is right in the middle of the muscle, and I call it intramural. Sometimes there can be a stalk-like structure supporting it, and it goes outside the uterus, and it is called pedunculated. So these are the various types of leiomyomata which can be physically seen in an X-ray or by the gynecologist. The same thing is very well described in a diagrammatic form, which I would like you people to kindly draw in your records. Look at this again, a triangular or a pear-shaped uterus. This is the uterine cavity, the endometrium over here, and this is the myometrium. These are the couple of fallopian tubes on either side. In this, it is right in the middle of the muscle. I would call it intramural fibroid. And here it is becoming pedunculated. Here also, but it is subserosal. This is submucosal in this case, and it is subserosal in this case. I would like you people to kindly draw these pictures. This is a very strange but an interesting picture picked up from Alamy, a wonderful source. This is a fallopian tube. I am identifying it by means of the fimbrial end of the fallopian tube. This particular word you must have in mind because whenever you get a specimen of a uterus, we will identify it by means of the fallopian tube and the fimbriae. And this is a very broad ligament, the broad ligament itself, in which I am finding a tumor. So this is called a wandering leiomyoma. It originated from the uterus and it has got into the broad ligament, a wandering leiomyoma. After some time, it will get its blood supply from the ovarian artery, in which case we will call it a parasitic leiomyoma. So we have seen the various situations where it can be located, the gross and the microscopic pictures of this. The microscopy is what we are going to see. Rather, this is a low power view, this is a high power view. In both, I am finding bundles of spindle-shaped cells. There is no space between the cells. All the dark ones are the nuclei, and the paler eosinophilic one is the cytoplasm. The nucleus is elongated, and it is supposed to be cigar-shaped. So bundles and bundles of these smooth muscle cells are there. And then what is this? Whenever I cut the bundle across, I'll be finding that like your tips of the fingers, which is called an end-on view of the smooth muscle or a cross-section of the smooth muscle. So bundles of spindle-shaped cells closely packed and they have got a eosinophilic cytoplasm, elongated nuclei with blunt ends. And this tumor, when compared with the earlier ones, I find that this is not well circumscribed. It is somewhat irregular. It is becoming fleshy. There are signs of degeneration. It is pinkish over here, becoming yellowish, and the tumor is obviously enlarged. It is not very well circumscribed. So this can become a malignant, or rather it is a malignant counterpart of the tumor called the leiomyosarcoma. Leiomyosarcoma is the malignant counterpart of the leiomyoma. And see over here, here also I am able to see some spindle-shaped cells, but there is a lot of edema and pleomorphism. These nuclei are dark, hyperchromatic. This is large. This nucleus is much larger, almost like a giant cell. There can be mitotic figures. All the changes, hemorrhage, necrosis can be seen, which is a classical feature of a leiomyosarcoma. So in this class, we had seen the uterus with the leiomyoma, which can be solitary as in this case, or it can be multiple, and these are the various locations. The diagram that I will have to draw. In both these, I find that it is a well circumscribed and a whorled tumor, whereas here it is irregular, fleshy, and pleomorphic. Here it is more or less regular, whereas I am able to see mitotic figures, hyperchromasia, etc. in a leiomyosarcoma. When it migrates, it is called a wandering leiomyoma. It can derive the blood supply from the ovarian artery. It is called a parasitic leiomyoma. Now, what is the importance of this particular chart? It can be kept as a gross specimen. Microscopy, it can be a slide for you people. Either of this is important as a short note or a short question. The entire chart can be composed and kept as a spotter, slide, or a chart for description. By voce, of course, the jar will be in front of you and the examiner can ask you a series of questions. If you answer well, they can ask you what are the other tumors that are similar to this. One is a fibroma. Leiomyoma is smooth muscle. Fibroma is composed of fibroblast-like cells. And to distinguish between the two, we will do a special stain. We will do a Van Giesen stain, where the muscle takes up yellow color. Leiomyoma becomes yellow in color, whereas fibrous and collagen will be red in color. The mesenteric on the contrary, the leiomyoma will be blue in color. So these two you people will have to remember. Meson's trichrome blue color and a Van Giesen muscle takes up yellow color. That is the completion of it. And these are my sources of reference. Thanks to LME and Wikipedia. Go back to R.A.T.S and game. Thank you again.